Don't miss.
Aspects like your nutrition, your exercise schedules, your vitamin supplementation, generally your well-being. You need to feel good about yourself. So we are saying live long but at maximum productivity. Be strong, like be at your best, not just fighting diseases, but be at your best. You're feeding well, you're sleeping well, you're mentally, you're in a proper mood. So that is medical wellness. So a little different from when you say wellness, people think of just the spas and the massage. No. Medical wellness has a medical perspective.
What is the definition?
Like I've said, it's a holistic approach to your well-being, which covers your body, your mind, your
mindset.
Yeah, your mindset. So it's broad, but at the end of the day, what you want is somebody to live a fulfilling life. A bit of the soul as well, but yeah, in that direction.
You talked about having enough rest. Some people sleep for 1 hour. Other people don't actually have sleep. There are some, some tabs that they take to get sleep. Other people, what causes some people to have lack of sleep? Is it also defined under medical awareness? Because when I heard you talk about it, you talked about the mind, the soul, the body, the weight, the feeding and the sleeping. Which is the sleeping, I guess, is more important. What is exactly time or hours for a person to sleep?
I'll answer it twofold. On average, 6 to 10 hours for an adult, but also depends on age and your level of activity. But when you talk about sleep, you introduce an interesting perspective of wellness. There is no disease condition that just attacks you one day and you're down. Diseases progress. Our bodies talk to us, our bodies complain. The challenge is, do we know how to listen to the body? So when you mention sleep, insomnia, that short intervals of uninterrupted sleep, most times they are speaking, they're telling you that something is not right somewhere. Sometimes it's because you're dehydrated, or like it's one of the languages of the body, failure to sleep. is one of the languages of the body. And we also use it to measure your wellness. As you feel better about yourself, the quality of your sleep also improves. Okay? So sleep is a very big factor. Some causes are physical, some are mental. When you're very stressed, some people fail to sleep. Some it's substance abuse, like it's broad. So we cannot generalize and say in all people the lack of sleep is because of this. No. Normally we advise that once you're having challenges like that, you visit a medical person and you get a wellness assessment. So they'll point out where does it go wrong, like why are you not able to sleep. I don't encourage people to depend on sleeping tablets all the time.
On the pills.
No. Let's go root cause. What has caused it? Okay? Is it something that can be changed by just adjustments in diet? Okay. Sometimes it's just an electrolyte imbalance. You need a bit more salt in your system. Or some people, we need to withdraw sugar towards their sleep. So, but it depends on an individual and the circumstances around them.
Right. What are the 4 types of medical wellness?
Medical wellness has a broad range of services. The first are preventive services. Can we, like, especially for the non-communicable diseases?
Maybe someone out there doesn't know what these diseases are.
Okay, diseases like diabetes, like high blood pressure, the cancers, the conditions of our body that make our body unwell, but they are not a result of an infection, an organism coming into our body. So they are just changes in our body which make us unwell. So diabetes, high blood pressure, our mental health is one of them, the cancers, you know. Now, we have the prevention and early detection of those. The other set of services, we call them rehabilitative. If you're not well, can we take you back to wellness? Can we reverse the process? And a lot of the reversal, a lot of these are managed by adjustments in nutrition, adjustment in your lifestyle, adjustments in maybe exercise schedules, okay? So it's not like you need to take medicine for all these. No. A lot of the conditions, why wellness now is because we've realized beyond medicine, there's a lot more we can do as ourselves to take ourselves away from those disease conditions. So we have the preventive, we have the rehabilitative, we have the psychosocial support, okay? Then we also have packages for wellness which are occupation related, okay? So like workplace issues, we sit a lot, okay? That sitting a lot is not, it's not it's healthy. Okay to sit, but when you sit a lot, it's now not healthy because it's predisposing you to certain conditions. And when we speak about sitting a lot, sedentary lifestyle, some people think, oh, those are problems for those who have offices, for the rich. No. If I'm sitting the whole day, my mother in the market is also seated the whole day.
Exactly, you're selling charcoal, but you're also seated the whole day.
The taxi driver is seated the whole day.
Yes.
A long distance truck, you know. So we want to open up and be honest with people that what we mean by you sit a lot is not because you sit in office, in air conditioning, no. Even in your day-to-day, sitting a lot. And when you talk about to like most of the ladies in the market, they'll say, I sit a lot and I find my feet are swollen.
Yes.
You've had, or I traveled a long distance and my feet are what?
Yes.
So the body's
actually,
talking to you.
I do have that certain thing that most times when I do travel long distances, I find that my feet have swollen. Yeah. So that's a wake-up call. That's
a wake-up call. Okay. So medical wellness. So we have those occupation-related. Okay. The border riders.
Yes, they ride.
They are riding, yes, they're seated, but they are in the wind, in the dust, they're inhaling all sorts of things. So part of their wellness would require things like lung checkups, lung health. Okay. There are many things I would say. It's broad. You can't say one jacket fits all.
Right.
It has to be tailored to an individual.
Okay.
But the other important thing about wellness is we want you to be part of your own journey for health.
So that was going to be actually that was going to be my question. Is like before we actually jump onto that question, if you could only tell us the 6 components of medical wellness, so that as we talk about that, then we can go to the importances of that medical awareness, because I know you have a camp coming up soon, or it's already ongoing, so we're going to talk about that. So just give us the six components of
the medical
wellness.
So they are packages, I would call them packages.
Yes.
And yes, I have a medical wellness center.
Yes.
Dr. A Medical Wellness Center. It's on the Chiraka Sangati Road.
Okay.
It's up and running. It's available. We're offering the services. So if I speak on broad packages, like I've said, we have packages for healthy lifestyle choices. Okay. Your weight control.
Does this also include the children that are obese?
Yes. Childhood obesity is part of it. So where weight control or adjustments in weight will influence the quality of your life. Diabetics need a lot of weight control support. The obese need a lot of weight control. Yes, so hypertension as well. Okay, in children, even things like epilepsy and autism, the calorie management matters. In some cancers, the dietary aspects of it matter. They improve the quality of your life as you deal with whatever condition. We also have pain management, pain relief, pain management. Maybe the ultraviolet, the UV light, the massages, the physiotherapy, let me call them the physiomechanics. That is also a component there. We have counseling. Okay, we have mental health screening.
Yes.
And then you'll prescribe a package. Maybe it could be counseling this person, maybe it could be taking them through reduction of substance abuse, or it's broad. Okay.
Doctor, let me ask you, does this also include the people that go through mental health, mentally, and also the ones that go through depression?
So let me call it mental wellness. You're supposed to be mentally well. So how do you preserve your mental health? The quality of your sleep, the things there's some diets, the things you watch, the environment around you. How do you preserve your mental health? Then how do you know that your mental health is breaking down? Okay? Poor sleep. You start withdrawing from things that you're so interested in. The depression starts setting in. That's the second component. Now the third is, how do we help you to get back to where you are?
Are there people that get stuck completely in that area when it comes to depression? Does it go further that they can't even get back from where they are, or from where they have been? Yes.
We also have mental diseases, mental health diseases, conditions. Some are not reversible, things like schizophrenia. Some have bipolar disorders. But again, these are, it's kind of difficult to know the predisposing factor. But we know that changes in lifestyle, changes in your environment can help to either stay the progress of these diseases or to make the person more acceptable of themselves. We even support people. I've had people who have suicidal tendencies, okay? But they get the support and they're able to navigate whatever their challenge is with guidance. I call it guided guidance. Okay?
So these people come to you when they feel like they want to, commit suicide, or is it a mental disorder that someone is going to wake up and commit suicide, or we do have a perspective that says that once in the family someone has ever killed themselves or hanged themselves, it will keep on following. That is, to us, the old African tradition,
like society. Some genetic predisposition.
Yes, so that's what we think. But is it?
Yeah, maybe some conditions could be, but I think things like suicide, for those who have come to us under those conditions, it's a relative, a parent, friends who bring them, and they didn't realize this person is so detached. The kind of things the person is talking about, like they kind of feel death will solve it. I'm better off dead.
Yes,
so I'm not an expert in that area, but yes, I've seen them. And at the Wellness Center, we have a full department for mental support with counselors, with a team that is structured especially for that. Adolescents are also supported. We've seen a lot of depression in the adolescents.
Oh yeah, true.
Even especially the boys. I don't know. The boys don't like to talk about it.
What could be the cause that
some is
boys?
Stigma. It's sad, but many boys are sexually abused, by the way, but they never talk about it. Okay?
Yeah, that's true.
Many of them are. They undergo a lot of these challenges. There is stigma that comes from. They sound like jokes. You're from a rich family, I'm from a poor family, I have this, you don't have that.
Yeah, true.
They sound like simple things, but at the end of the day, they really impact on the esteem, on the confidence of this child. Okay? I have a daughter who is very, very tall. She's much taller than me.
Oh.
And everywhere she goes, everyone will point out, she's very tall, she's very tall, she's very tall.
True.
Whereas it's a beautiful attribute. She needs to be supported to stop feeling alienated. Okay? Her mind. You understand? So I also have, I've seen a few of the children who are dealing with obesity. What? She's only 11 years old? And she's this size? You know,
you see the
much
problem
as,
the society.
Yeah, the society. You can't just stop the society from talking. I mean, they're not saying it in bad faith, but some of those comments get to a child.
Yeah. So
you find a child is detaching when others are going to play, she doesn't want to play, you know. So it's broad, but all we say is, and why I feel these sessions are important. How do we know when our wellness is breaking down? Okay, unnecessary weight gain. Your diet is the same, your lifestyle is the same, but all of a sudden you're gaining weight. Issues around poor sleep, you know, disinterest in your environment. There are also certain physical attributes, swollen feet, you wake up with a puffy face. The one which most of us don't want to accept is that excessive fatigue. You sleep even for the 8 hours, but by morning you still feel exhausted. Your morale for whatever you're doing is down. Once you experience things like that, don't take it lightly. Most likely the body is talking to you.
All right.
Yes.
All right. Of course, you are still watching U24. You can follow us on X at U24 Television UG. You can as well follow this conversation on U24 Television, which is YouTube. We are also on Facebook, which is a U24 TV station. So you can follow us and get to know about and understand more about, you know, the medical awareness. But so very many people out there did not know about this. I, for one, I could not tell that there's certain factors that can cause to that. I am even shocked that Dr. Agnes has talked about suicide. So sometimes it's mental and depression that maybe could lead someone into suicide. We're going to go for a very short break. When we come back, we're going to be talking more about medical wellness. We're going to look at about diabetes. We're going to look about high blood pressure. How can we prevent these diseases? Do we need to take medication, or there's something that is going to be done? All that is happening right here on our talk show. But remember, how do you prevent your mental health, and how does medical wellness help us? Let's go into a very musical short break. When we come back, we'll be talking through more about medical wellness.
Bien nasubira sigenda bakatinze biso